Should adults be worried about hand-foot-mouth disease or HFMD? Today, I'm going to talk about hand-foot-mouth disease, which is more common among children, but more and more adults are getting infected nowadays. I'm Dr. Mel. I am a pediatrician, and if you are new in my channel, please subscribe to my YouTube channel, Health.Faith.Fullness. Continue to support me by tapping the bell icon, like, share, and comment on my videos in YouTube, not on my FB page, please. In this video, I will talk about the different signs and symptoms of hand-foot-mouth disease, both in children and adults, how long this disease lasts, and why more and more adults are being infected. Please stick to me until the end to be able for adults to know if they need to get worried once diagnosed with HFMD. And of course, you'll know the treatment. That's your prize for staying up to the end of this video. I'll share to you the fastest way to recover from HFMD. So, what is HFMD? It is a viral illness that is due to enteroviruses. The diagnosis is actually straightforward, meaning it's so easy to diagnose. Even you can diagnose your own selves, especially when you see the characteristic vesicles in the mouth, hands, and feet. HFMD cases can range from mild to severe. You may develop painful sores in your mouth and an itchy rash in your hands, feet, arms, legs, buttocks, genitals, belly, and back. In other words, it can develop all over your body. Usually, patients with HFMD also develops fever, decreased appetite, sore throat, which can lead to dehydration. So, these are the signs and symptoms of HFMD. And about the duration, how long does HFMD last in children and adults? Most patients with HFMD will recover from 7 to 10 days, even without medical treatment. However, children under 2 years old can be sick for longer duration. As I see in my patients, there are children with HFMD recovering only after 3 weeks. And to answer the question, should adults be worried? Well, it's good news. Actually, HFMD is generally not serious in adults and children. However, there are also adults who may not show any signs of the virus, but you can still pass it along to your family members. So, when someone is affected with HFMD at home, here are some tips to prevent the spread of HFMD at home. Number 1, wash your hands with soap and water often. If you want to review the proper hand washing, I made a previous video on this and I will give the link below. Because soap and water may not always be available, it can help to carry a travel-size hand sanitizer with you. Number 2 tip is to keep your hands away from your eyes, nose, and mouth. The virus can get inside your body through your mouth, eyes, or nose. And number 3 tip is to avoid close contact with anyone with HFMD. This disease often spreads when the infected person coughs or sneezes. So, it's better to avoid getting close or wear your mask. Number 4 tip is to disinfect any surface that we frequently touch, like doorknobs, counters, and other surfaces. The virus that causes HFMD can spread from one person to another when you touch an infected surface. Therefore, disinfecting these areas can help prevent the disease from spreading. So, are these tips familiar? It's actually the same as the protocol that we follow with COVID infections. So, following all these protocols will help us prevent many infectious diseases, not only HFMD. So, I hope we still follow and continue what we had been doing since the pandemic. And the last but not the least to be discussed is the treatment. So, here's the fastest way for you to recover when you are diagnosed with HFMD. You can take over-the-counter medications to relieve the fever and pain like paracetamol. Never take aspirin or give it to your children. Drink enough liquids to prevent dehydration. You can take oral rehydration solution to prevent dehydration. Mouth sores are painful, so I usually prescribe topical spray to my patients unless they have contraindication to it. You can also drink cold beverages to treat the oral inflammation or apply topical preparation for the mouth. Avoid hot drinks or acidic foods as they will make the pain worse. We have just talked about the signs and symptoms and treatment of HFMD in both children and adults. I hope this video is helpful to all parents and all adults diagnosed to have HFMD. Now, if you still have questions, please comment down below. Thank you so much for watching. I'll see you on this video on hand washing.